The Hippocratic Oath states that physicians will, quote, do no harm or injustice to their patients. Unfortunately, many medical schools have abandoned this oath, not only by advocating for abortion and child mutilation, but also by allowing political activism into the exam room in the form of DEI and anti-Semitism. Medical schools should be teaching the next generation of doctors and nurses to save every life and protect all those under their care, even the unborn, which, thanks to technology, we have a window into the womb. They are babies. This committee will continue to investigate these schools to ensure they are complying with federal law and reserves the right to withhold funding from any institution in violation. Dr. Benedetti, the University of Illinois College of Medicine is one of the largest medical schools in the country. And with that, you have a profound responsibility to properly train our next generation of providers. Has UICM complied with President Trump's executive orders to eliminate federally funded DEI programs?
We, in personal...
Yes or no? Have you complied?
To my knowledge, we did everything we could.
UICM affirmed that it will, quote, I quote you, not react preemptively to actions made by the current administration, insinuating that the medical college does not intend to comply with directives issued by this administration. Also troubling Dr. Benedetti, it appears that DEI has not left UICM. On your school's About page, clear as day, it says, and I quote, at the University of Illinois College of Medicine, we are committed to diversity and inclusion. We have a number of programs and initiatives in place to promote diversity and inclusion. It's clear that UICM is just hiding the fact that DEI is still its core mission. Dr. Haygood, UCSF's classroom guide titled Framework for Gender and Sex Concepts in Teaching advises against using the term pregnant women. Instead, it says to use pregnant people. Who are pregnant people compared to pregnant women? Just curious.
So that is a part of a curriculum to help our students who are facing a wide diversity of patients. Of course, the vast majority of pregnancies are in women, and I have absolutely no problem with using the word pregnant women. I use it myself.
Has a non-biological woman ever had a baby?
A transgender person can.
That's not a biological woman. Has a non-biological woman ever had a baby?
I would
No,
reiterate,
it's ridiculous.
We take care of transgender patients.
Dr. Hagood, the UCSF guide I mentioned earlier also advises using a child's self-reported gender identity even if it conflicts with the parent's wishes. Say a 7-year-old boy comes into your doctor's office and reveals he believes he's a girl. Is UCSF advising physicians to explicitly violate parents' moral values and have the doctors address this boy as a girl?
Our programs are consistent with federal and state law. We undertake comprehensive psychological and mental health evaluations and work with the parents on these issues.
Okay, and I hope that you are consistent with the law because, like I say, we reserve the right, we have the right to withhold funding from any institution in violation. Lastly, Dr. Dubonnet, a required course at UCLA Medical School, advises OBGYN students not to, and I quote, assume gender identity. Okay, from another class in May of 2026, it included a disclaimer that while it uses the term she and women, it does not intend to exclude, and I quote, those who have a uterus but do not identify with these terms. What does that even mean?
I'm not familiar with that announcement. I'd have to read the entire thing.
Okay, I hope that you go back and check it out. Can someone have a uterus but not be a woman? Because it seems like your school is promoting that ridiculous idea.
I think, again, as Dr. Hagood has described, we're treating transgender people, but we're doing that in compliance with state and federal law.
And you do teach biology?
Yes, we do.
Yes, this is curious. So I'm going to ask you again, can someone have a uterus and not be a woman? Just say yes or no. Can they?
Again, I would need
That's
to
what-
look at
gentlelady's-
That's
that
what your
announcement.
medical school is promoting.
The gentlelady's time
Mr.
is...
Chairman, it's clear these medical schools are hiding DEI curriculum under the guise of medical access.
Gentlelady's time
I
has
yield back.
expired.